Hi, Dr. Jeff Waldron here. Today I'm going to talk about knee pain. There's a lot of different types of knee pain, and the specific one I'm going to talk about today is a type of pain that you get that's more stiff dominant. It allows you to do most of your activities, and it's this 3 exercises we're going to go over today are a little more advanced for some types of knee pain, and the best way to know if this will be good for you, you're usually someone that's had, let's say, a meniscus surgery or a knee surgery of some sort, and your knee's really stiff afterwards. You've rehabilitated it, you're several months past that surgery or a year out, and you continue to have pain after you walk or after you go for a run or after you climb or hike or do a certain amount of activities. Usually can kind of walk on your tiptoes. You sometimes have issues with walking on your heels, or your hips will kind of go backwards like this because your knee isn't straightening all the way. So these 3 exercises will really help that kind of stiff dominant knee pattern and allow you to do those activities and not have as much pain afterwards. A lot of times if you walk and it hurts at the end of a walk or after a hike, there's some stability issues in the knee and some weakness. So these 3 exercises are geared towards fixing some of that stiffness and stability issues and allowing your endurance to increase for the knee with those activities, with some common muscle imbalances that we see with a knee that's still stiff and not performing, and certain muscles aren't activating at the appropriate time. So the first one you can do, it requires a little bit of balance. You're going to stand on one leg, so preferably the knee that's causing the issue, and then you're going to keep your shoulders and hips nice and straight. You don't want to twist your back. You keep the shoulders right over the hips and you twist towards the affected side. So I'm twisting towards the right, and what this is doing is it is activating some hip rotators in the hip. It's also creating a little bit of rotation here at the knee because the knee has gotten a little stiff on the outer part of the knee. And as you move, it should be completely pain-free. You might feel a little wobbly and tip, and you may need to hold on to something at first when you're first doing this. But try and just hold yourself nice and still. Go through small, controlled movements. It's not about getting the big movement. It's just what you can do, holding yourself nice and stable, just doing these slight little turns. You can do this several times a day if it's not hurting. And you want to watch, how do I feel while I do the activity and how do I feel afterwards? So if it hurts while you're doing it, you need to stop. If you do it and you're like, oh, it kind of hurts a little bit, but as you do more, it gets better, that's okay. But if the pain starts to build, you need to stop right away. If you finish the activity, and let's say you're walking around and then you have more of your knee pain, you may need to stop. There's some other structural problems in the knee that sometimes can occur that can cause that. But if you're sore in your muscles or your core or something like that, that's okay. We really want to get these hip muscles activated. So that's the first exercise. The second exercise that I like, you can see them in my stockings here on a hard surface, so you can be in your kitchen, bathroom, somewhere in your house. If you have carpet everywhere, you can use furniture sliders or something like that to put the sliding foot on. But this next one engages your hips, stabilizes your knee. So you're going to just put your foot out and you're going to put the other one out to the side, and you're going to do this ice skating like movement. You want to keep your knee directly over your ankle. You don't want it to go out or in like this. So you just hold it nice and still. You slide out, keeping your trunk upright. And I'm not pulling myself up from this side. What I'm doing is I'm pushing down, driving through this quadricep, so this top thigh muscle, to bring myself back up. So I keep pulling, going up and down, working on my posture. Only go as far as you can with control. So if this is your practice today, that's fine. If you can go further and advance it and still maintain all this without twisting the knee, then you can go a little further out. The other thing you can do is you can add a little lift with your toes. So if you tend to substitute with your calf muscle, pulling your toes up will force you to isolate your hip and your quadricep a little bit more. And now I've taken that substitution out and I'm really locking up and forcing that knee to work. So that's the second exercise. The third one that's very helpful, I'm going to just turn sideways. You're going to go backwards with your leg, keeping yourself nice and upright. You slide backwards. I pull from this leg, driving down, pulling myself back up. So I go down, back up. I can add the toe modification, lifting the toes, where I slide down, and then I pull back up, being sure not to drive the knee over the toes or twist in and out. Nice small movements. I could be just right here, nice and easy. I don't have to go all the way back. You just do what you can today. So I hope that helps those stiff dominant knees and you're able to get out there and run and do all the activities you enjoy without that knee pain. Thanks for watching, and click subscribe or share it with your friends if you enjoyed this video. Thank you.